Hello, my name is Dr. Erica Richards, and I'm a psychiatrist at Sibley Memorial Hospital in Washington, D.C., where I serve as chair and medical director in the Department of Psychiatry and Behavioral Health. I'm pleased to serve as your moderator for this special podcast on menopause and women of color as part of Johns Hopkins Medicine's Journey for a Women of Color series. This year's series will feature discussions on ethnic skin and cosmetic surgery for women of color, menopause for women of color, and what women of color should know about multiple myeloma. All three will be released on April 1st in recognition of Health Disparities Month. I hope you will find time to make a plan to listen to each of these podcasts featuring Johns Hopkins Medicine physicians. In this podcast, I will be discussing menopause and special issues of concern for women of color. My guest today is Associate Professor of Gynecology and Obstetrics, Dr. Wen Shen, who serves as Director of the Women's Wellness and Healthy Aging Program at Johns Hopkins. Thank you for joining me, Dr. Shen, and welcome.
Thank you very much for having me.
So let's just dive in. All women will eventually experience menopause, and each woman's experience is unique. According to the Study of Women's Health Across the Nation, or the SWAN study, women of color tend to enter menopause and perimenopause at earlier ages than their white peers, have longer transition periods, and experience more intense hot flashes and vaginal symptoms. Another study in menopause in the Journal of North American Menopause Society found some interesting data on the higher risk of gastrointestinal issues, bloating, and nausea around menopause in women in certain ethnic groups. That's a lot. Can you elaborate on this, Dr. Shen?
During the perimenopause and postmenopause, women of color are definitely at a disadvantage. Part of that is because maybe a lifelong disparity in healthcare and having more burden on their health as they age, so that when they get to menopause, the loss of ovarian hormones cause further issues with their heart, such as cardiovascular health, also osteoporosis and dementia. So there is that burden of health disparities. And then also, yes, women of color do have more severe symptoms in the perimenopause. The studies have shown that. And is that because of the increased stress in their lives? Because the studies also show that there is a higher social burden for women of color with regards to family, to income level, to different stressors in life. And so the cortisol levels are relatively higher for women who are experiencing those stressors and can further aggravate their health. And so women start earlier. On the average age of menopause in the United States is between 51 and 52. But for women of color, it is down to maybe 48, 49. And then the transition takes longer until they reach their final menstrual period. So when a woman goes for 12 consecutive months spontaneously without a menstrual period, then she is considered postmenopausal. And during that time, during the perimenopause, is when the symptoms tend to be at their worst. So take heart, once a woman is postmenopausal, the symptoms do tend to improve for most women. But during perimenopause, the symptoms are definitely at their worst. And so if you have a longer time of perimenopause, then that's really quite awful. If your perimenopause is going to be lasting up to 10 years, that's really significant. 10 years isn't something that you can just tough it out. And during that 10 years, also, there's a lot of health changes that's occurring that will severely impact your future health and your ability to live until your mid-80s in a healthful fashion. And then with regards to the GI function, yes, I hear that daily. Patients who come in saying that their two worst symptoms are, number one, hot flashes, which affects their ability to sleep, and number two, weight gain. And a lot of women come to me already having been on healthful diets, calorie control, and exercising. And they can't lose weight, or some even are still gaining weight. So this is an area of interest and a lot of research going on. We don't know exactly what causes that. It appears to be a multifactorial problem between aging, menopause, the gastric hormones that are secreted in the gut. So stay tuned. There's a lot of research that we hope that can come up and help women, but we do have a healthful eating activity and weight program at Hopkins that is staffed by physicians who did additional training, and they will help my patients that I send them and review very carefully. They do a lot more than just hand a diet plan to the patient and say, here, follow this and go exercise, because we already know for most of the patients that didn't work. So they can do a basal metabolic rate testing. They can do different blood tests, as well as very thoroughly evaluate what medications the patient is taking, because as we know, a lot of the medications can affect your weight, your metabolism. It is a multidisciplinary effort during the perimenopause and postmenopause times to help women remain healthy.
That's very interesting. And so I guess part of the question when you talk about this longer transition period, is it something that women of color, for example, can identify? We talk about getting them into a multidisciplinary approach. Is it something that they understand that this is a longer period and they know when it starts, or do they go kind of undiagnosed for some time before that?
Unfortunately, across the board, and because it does start earlier for women of color may especially not be aware that the symptoms that they're experiencing has to do with being perimenopausal, because they themselves or their providers just may not be aware that this is a possibility. And so they may get referred for other testing and other treatments that basically don't work. And then retrospectively, the patient realizes, oh, I was starting my menopause already back then. And that's what it's. So one of the biggest tasks that I feel the medical profession should do is to educate the public and to let women know about the most common symptoms of perimenopause, and to speak up and to ask if this could be their perimenopause. And if they don't get any response or any action on that part, women should reach out for specialized menopause practitioners to be evaluated and to be treated as necessary.
Thanks. And you talk about these most common perimenopausal symptoms, for example. Are those universal, or are there any symptoms that are specific, for example, for women of color?
They are not at all universal, and I'm always surprised. I don't take anything for granted. I get patients who come in with really interesting symptoms. And if the patient is convinced that it has to do with them being perimenopausal, I will evaluate them. If they have no contraindications, I will say, okay, we can do a 3-month trial of menopause hormone therapies and see if your symptoms do improve. And so, yes, they do differ. For women of color, it does tend to be hot flashes, and changes in the menstrual cycle is a very common symptom. And part of that is also complicated by the fact that there is a greater disease burden with fibroid for women of color, which can create a lot of changes in the menstrual cycle. So there needs to be a very thorough evaluation of what's going on, and to then come to the conclusion that what she is going through is perimenopausal rather than any other etiology. For Asian women, what the clinical trials had shown is that it's not so much hot flashes and abnormal bleeding. It's more bone pain, arthralgias, pain in the joints, and also a certain amount of anxiety and depression. So yes, there's definite ethnic and racial differences in the most common symptoms across the board.
feel like we're going to have another discussion one day about our intersection of mental health and the menopausal time frame, because it's such an interesting topic.
You're absolutely right. That's another one of the most common symptoms that I would see patients who come in with severe mood changes, anxiety, depression, hot flashes associated with a near panic type of symptom, and severe irritability. Patients who come in and say, I don't recognize myself anymore and I can't stand myself. What is going on with me? And that's the other thing, is that as women, we tend to blame ourselves for what happened. And so the patients come in and say, what's wrong with me? And I'm like, no, it's not what's wrong with you. It's this stage of life and we can do something about it.
Putting the mood symptoms aside and the anxiety symptoms aside, and coming back though to that core reason, the decrease in hormones. What do we see in terms of the long-term effects of that? So if we take it back to women of color starting perimenopause early in life, do they have more of the downstream effects, the osteoporosis, those sort of long-term, dare I say, consequences of early menopause?
There is evidence that when a woman is having hot flashes and those what we call vasomotor symptoms, that there is indication that those symptoms are associated with cardiovascular changes. And women who ignore those symptoms or are not treated for those symptoms may be at increased risk for having heart disease and other cardiovascular changes as they age. So it is very important that a woman is not ignored and is treated properly for the vasomotor symptoms. With regards to osteoporosis, one of the primary causes of osteoporosis is the loss of estrogen. If a woman starts her menopause earlier and has a longer time of low estrogen, she can be having more bone loss. So that is another issue. And then the third symptom, the third disease, is dementia. If you develop cardiovascular disease, that can also lead to early onset dementia.
One of the things that we see in the news a lot pertains to the other side of the spectrum of maybe a woman's reproductive cycle and the importance of having potentially a physician or a care provider of color for women of color during pregnancy. Do you see that across the lifespan? Is that the same thing, knowing that there are many skill sets that providers have, but do you see similar outcomes in people during the perimenopausal or menopausal period, and who cares for them?
Yes. So there are some surveys that have shown that, yes, for a woman of color to have a provider who is also a woman of color can ease the communication and the trust factor that's involved, because historically, women of color are more dismissed with the symptoms and the issues surrounding perimenopause are ignored. And so having somebody who can listen and understand and treat them accordingly is very, very important.
Thank you. I think that this is such an interesting topic, and understanding those nuances of all the patients that we care for is very important. So I'd like to thank you for your time and for giving us so much to think about and talk about potentially even in this forum in the future. And for everyone watching, I'd like to thank you for joining us today on this special podcast on menopause and women of color. It's been my honor to serve as special guest moderator for Journey for Women of Color. Thank you, Dr. Shen, for being our guest today. Johns Hopkins Medicine, thank you for A Woman's Journey. And they'd also like to thank Astellas for its unrestricted educational support of this year's Journey for Women of Color podcast series. If you've enjoyed today's discussion, please check us out at A Woman's Journey website. And for more information about the upcoming free webinars, subscribe to A Woman's Journey's Insights That Matter podcast series. Please sign up for A Woman's Journey monthly emails as well. Thank you again.
Thank you.